Hello students. So today we are going to learn something about what are the factors that affect disease conditions. So before we proceed in our topic, we should know what is the difference between disease and disorder, right? Disease is a pathological process having like characteristic set of signs and symptoms. Since it may influenced by the extrinsic things like viruses or bacteria, and it is curable. The important point is it is curable, right? It's transmittable. But disorder is a disturbance or derangement that affect the function of some function of mind or body. It is caused by intrinsic abnormalities like birth defect, genetic malfunctions, and it is not transmissible. Not transmissible. We should know factors and risk factors. Difference between them. Factors and risk factors. Right? Factors are something that help to produce or influence the disease condition, like geriatric. Geriatric means all people are more prone to COVID-19 viruses, as we have saw in the last year. And the risk factor is like that can increase an individual chances of developing a disease, like smoking, tobacco, etc. Right? So now we will move on our topic, that is what are the factors that affect disease conditions. So here are mainly three factors that can affect a disease condition, like agent factor, host factor, or informant factor. So these three in combination may affect the disease conditions. So first, in the agent factor, we will see regarding biological factors, chemical factors, physical factors, and nutritional factors. And in environmental factors, we will see regarding geology, climate, surrounding factors, vectors, and housing, and their effect on the disease. And the last one, and this in this environmental factors, the environment influences the agent, the host, and the route of transmission. This is important. Of the agent from a source to host. And at the host factors, we will see regarding how age affects sex, socioeconomic status, behavior, genotype, nutritional status, immunological status, and occupations. These three things we will broadly uh, discuss in further slides, right? So in the host factors, that means we have saw three components: an external agent, a susceptible host, and an environment. If the presence of all these things will be available, then there will be disease, right? We will talk about agent factors. Second, we will talk regarding host factors, and third, we will talk regarding environmental factors. So first factor in that we see regarding biological factors, like under the agent factors, biological factors like bacteria, viruses, parasites, and these are another zoonotic disease are termed as biological factors and must be present for disease to occur. Means these like COVID-19 must be present for COVID-19 infection, like that, and it is necessary but not always sufficient to cause a disease. Like if your immune system is very strong, then even COVID-19 cannot cause infections on your lungs, right? So always it is not necessary that causing factors may cause the disease. The second is physical agents. Means physical, like environmental or external factors may associate with the risk of disease, like heat, light, noise, that may affect the, like UV radiation may cause the skin cancers, like that. Radiation, pollutions may cause COPD like disorders, COPD, chronic obstructive pulmonary disease, or asthma. And in case of chemical factors, like if you are working in an industry there with the exposure of chemicals may leads to injury to your nose or your lungs due to inhaling of the chemicals that include physical, chemical, biological, mechanical, and electrical factors that may affect the disease conditions. And the last one is nutritional factors that may include deficiency. Like if you have deficiency of vitamins, then may cause some diseases, and may cause obesity, eating disorders, or chronic disease, may cause the increase or enhance the case of your disease conditions. Cardiovascular disease, if you have high concentration of lipids in your lipid or cholesterol in your body, then it may cause cardiovascular diseases like atherosclerosis, etc. Hypertension may be caused due to high consumption of salts or other factors, other secondary factors, like if you have tumor on adrenal glands. Cancer may cause due to some other factors. Diabetes mellitus is may cause due to some nutritional factors. Now we will talk regarding host factors. In host factors, first we will talk regarding age, how age uh, affect the disease condition, right? So age is associated with occurrence of disease like bacteria or virus may attack the old people very fast. So major risk of aging are like chronic inflammatory diseases. Chronic inflammatory diseases, example like cardiovascular diseases, dementia, cancer, COPD. COPD comes under chronic inflammatory diseases, and these may occur due to age. Now, if we'll talk regarding the sex, then 2 to 3 times more women are more prone to women are 2 to 3 times more prone to men than of mental health diseases, right? So this is caused due to imbalance in their hormonal or reproductive levels, right? So socioeconomic status means this is the fundamental cause of disease. People who are very poor or powerless have worse health and longevity than those of money, power, and prestige. This situation is caused due to they do not have proper sanitation, or they are living in overcrowding place, leads to different diseases like airways diseases like asthma or COPD, right? So in polluted area, if they live, the poor people, then they may lead to asthma or COPD disease. These are socioeconomic factors. Then we will talk regarding the behaviors. Some behaviors like alcohol consumption, like smoking, high fat consumptions. These things may affect the disease condition or may cause the disease, may be a cause or factors for the disease occurrence, right? This is the host factors. And in genotype also we will see regarding like Down syndrome disease caused due to genotype, beta thalassemia, and like one more thing, G6PD, glucose 6 phosphate dehydrogenase deficiency may lead to hemolytic anemia in some patient due to consumption of some sulfonamides, right? So different in genotype may affect the disease conditions. Now this nutritional nutritional status related to disease that include the development of abnormalities that can be prevented by diet, hereditary metabolic disorders that respond to dietary treatments, food allergens. These are nutritional factors. And now we cannot talk regarding the immunological status. Immunological disease or conditions caused by dysfunction of immune system. If your immune system get dysfunctioned, then you may cause disease. Uh, it include like allergy, you may cause asthma, you may cause autoimmune disease. Autoimmune disease includes like uh, rheumatoid arthritis, etc. comes under immunological factors. And if you're gonna talk regarding the physiological factors that affect the other medical conditions, is the disorder that is diagnosed when a general medical condition is adversely affected by physiological or behavioral factors. These physiological factors may precipitate or exacerbate the medical condition, interference or treatment that contribute to morbidity, means that contribute to the death of the patients, right? And now we're going to talk regarding the environmental factors. This is the last factor that affect that this is the last major factors that affect the disease conditions. So talk regarding the geology. These are disease extrinsic factors. Extrinsic factors and natural occurring elements in surface like water, groundwater, soil. So in this, some bacteria, viruses, or other things may present. So long-term exposure of arsenic drinking, arsenic containing water may develop skin conditions, may develop and skin condition and cancer. Right? These are geological factors. So we're going to talk regarding climate change. It's climate like climate change may to temperature, humidity, solar radiation. These may affect disease conditions, right? The surrounding, how surrounding affect disease conditions like air pollution, water pollution may affect disease conditions. We're going to talk regarding vectors. Vector-borne disease or infectious diseases caused due to either mosquito, ticks, some bugs, black flies, etc. These are these are known as vectors, right? So the vectors like these mosquito, female anopheles mosquito may leads to dengue, right? So these vectors may affect the disease conditions. And now I will talk regarding housing. Housing is very important since it prevent us from the potential hazards and can promote the well-beings, right? So if people live in unstable, unsuitable house, they may be at risk of exposure to a number of potential health hazards. Poor housing may cause contribute to many preventable injuries and conditions respiratory, such as respiratory, nervous system, cardiovascular system, or as well as cancer disease also. Right. So, in summary, what we have talked regarding in this the whole session, we have talked regarding what are the factors that affect disease condition. In as an factor, we have included biological, chemical, physical, and nutritional factors. In environmental factors, we have included geology, climate, surrounding factors, and housings. And in host factors, we have so regarding the age factors, sex factors, socioeconomic status, behaviors like drug abuse, lifestyle, genotype changes can affect the disease condition. Nutrition styles like lack of family nutrition may affect the disease conditions, and some like immunocompromised persons may prone to the COVID-19 infections or other such infectious diseases. Occupation like chemical hazards, physical hazards may affect the disease conditions. So that's all about today. So here we complete. Thank you for watching the video.